The finely designed collection chamber assists in observation and measurement of fluid drainage. The minimal measurable unit is 2 milliliters. When the unit is attached to external suction source, the chest suction pressure can be regulated through adding the fluid in the suction control chamber. It means that the chest suction pressure depends on the fluid amount in the suction control chamber. The external water seal duct helps to observe respiratory condition and measure the negative pressure in the chest. The reflux prevention valve avoids backflow from water seal duct to collection chamber and prevents drainage in collection chamber from flowing back to patient's chest. The positive pressure releases valve aids positive pressure, releasing spontaneously to promote air elimination. The dust-proof cap effectively prevents dust from dropping into the unit spontaneously. It does not impact on air elimination. Manual negative pressure release valve helps to release the excessively negative pressure in collection chamber. The bellows on the drainage tube ensure the normal drainage function. The chest drainage unit is designed with sampling port, which can be placed in any part of the drainage tube. Check the package of product. Do not use the product if it is broken. Open the package. Check the appearance of the unit. Do not use the product if there is breakage or crack. Swing out the rotating bracket and place on a flat surface. Insert the funnel into suction port. Switch the suction control stopcock to open. Gently pour the normal saline or sterile water into the suction control chamber until the fluid level reaches 0 level. Remove the funnel. To test the seal of the unit, clamp the distal part of the drainage tube. Then milk the drainage tube for several times. The seal property is intact if the fluid fluctuation is present in the water seal duct. Do not use the unit if the fluctuation is absent. Remove the dust-proof cap and insert the funnel into the suction control chamber entry. Gently pour the normal saline or sterile water into the suction control chamber to prescribed fluid level. Remove the funnel. Cover the suction control chamber entry with dust-proof cap. Switch the suction control stopcock to close. Turn on external suction source. Attach the suction tube to the suction port. Adjust the suction control stopcock until continuous gentle bubbling occurs in the suction control chamber. The chest drainage unit must be placed below the patient's chest level. To prevent accidental knockover, swing out the rotating bracket and put on a flat surface or hang the unit on the bed frame with hangers. The drainage tube should be properly secured on the bed. Leave adequate length to prevent pulling. Remove the sheath. Attach the chest tube to drainage tube. When drainage sampling needed, select a proper site for sample collection on the drainage tube. Clamp the distal part of the tube, cut with scissors, and connect two edges with the sampling port. Gather the drainage at the sampling port. Then insert male lure slip syringe into sampling port to draw drainage. When the suction control stopcock is closed, the plenty of persistent bubbling occurs in water seal chamber, indicating that the patient may develop the pneumothorax. Physician should be notified immediately. The fluid in water seal duct keeping in high level indicates the excessive suction pressure. The interventions of releasing pressure should be taken. Notify physician if these interventions fail to restore the normal drainage system.